Managing diabetes without medication involves making significant lifestyle changes to control blood sugar levels. Here are some tips that can help. Follow a healthy diet. Focus on eating a balanced diet that is low in sugar, refined carbohydrates, and saturated fats. Choose foods that are rich in fiber, such as whole grains, fruits, vegetables, and lean protein. Exercise regularly. Physical activity can help control blood sugar levels by burning glucose for energy. Aim for at least 30 minutes of moderate intensity exercise, such as brisk walking, most days of the week. Manage stress. Stress can cause blood sugar levels to rise, so it's important to find ways to manage stress. Try relaxation techniques such as deep breathing, meditation, or yoga. Get enough sleep. Lack of sleep can affect blood sugar levels and insulin sensitivity. Try to get at least 7 to 8 hours of sleep each night. Monitor your blood sugar levels. Regular monitoring can help you identify patterns in your blood sugar levels and adjust your lifestyle accordingly. Maintain a healthy weight. Losing weight can help improve insulin sensitivity and lower blood sugar levels. Talk to your doctor or a registered dietitian for guidance on healthy weight loss strategies. It's essential to work with your doctor to monitor your blood sugar levels and adjust your treatment plan if necessary. While lifestyle changes can be effective in managing diabetes, they may not be enough for everyone, and medication may still be needed.